講言語呢，哦。
Alright, today I want to talk about the wrist and the hand injury. First, that we have to know the anatomy, because that's our orthopedic doctor. And the first point is that we have to know the anatomy. And after that, you know the anatomy, and then you know how to do the injury examination. After examination, you find that the disease itself, and then you will know how to treat it in the principle. So today I want to talk is all the principle, just only principle. So just only follow me from anatomy, and then to the examination, and then how to treat it. That's the principal method. After that, we divide it into the bone and soft tissue injury, the outline, okay? So today that's quite easy. Don't worry about that. Maybe after this class, 90% of the test just inside inside this learning object. Okay. Now, first of all, you have to know once a patient wants to visit you and step inside of the outpatient clinic, you have to see the posture itself. Sometimes just holding the hand or holding the elbow, and maybe there's a soft tissue injury or bone destruction, right? So you have to know the posture. And then the second is that circulation. If the hand already pale, maybe there's some injury around the artery or vein, and then the cause pale, right? And after that, the general function is okay or not. So after the posture observation, and then we start from the elbow. Okay, patient come to see you and say the elbow hurt. What's your first diagnosis? How to diagnose it? Just only I said divided into bone and soft tissue, right? Okay, divided into bone. If that hurt, then you say any trauma, any traffic accident, falling from high. They say no. Okay, part of that. Maybe that's another bone lesion, right? Maybe that's a soft tissue injury. Okay, if that bone lesion, maybe swollen, deformity, but in this elbow, there's not quite deformity, right? And that's a no trauma injury. So maybe that's a soft tissue. Okay, soft tissue around elbow. What kind of soft tissue injury? Most frequently. Okay, so start from what I said, from anatomy. Okay, you know from anterior, this is the anterior side. All the anterior side tendon, fossa tendon, origin from what? From humerus epicondyle area, right? But that's the origin from that. That's a wrist flexion. Major, that's a wrist flexion. That's the origin from medial epicondyle here. And go deeply, fingers. Most fingers, FDP, that's all from proximal side of the elbow. But the distal one, the profundus, that's from the middle of the forearm, right? That's anatomy. But I know in your second grade, when learning about anatomy, you just learning about the muscle, the name. You always forgot to learn about the origin and insertion, right? But right now, you already know the name of the muscle itself. Right now, you have to learn about the origin. Why? Okay. The same, the posterior side, that's extension. All the wrist extension from the lateral epicondyle area. Okay? And go deeply. The finger, distal finger extension also the same but the thumb is from the middle of the forearm. So that's origin and insertion. And now in your anatomy, you did not learn about that. You just only remember the muscle itself, but you forgot to learn about the origin and insertion. Okay, and why I want to say that? Okay, this bony anatomy, a lot of this is one lateral epicondyle. Patient said that around here, pain, tenderness. Okay, what's your diagnosis? Not a bony lesion around the epicondyle area. Lateral epicondyle, that's extensor tendon origin, right? What kind of extensor tendon? Wrist extensor, right? The previous I said, wrist extensor. You could see extensor, wrist, extensor carpi brevis, extensor carpi longus, extensor carpi annulis, right? Radius and annus. That's all origin from the lateral epicondyle, right? So that's a hurt. Why? Why hurt? Carpi longus, brevis, and common extensor always from here. So that means this area have some problem. What kind of problem? Maybe there's an inflammation change, or overuse induce inflammation and then induce pain, right? Okay, why that's overuse? That's because some of you to play in the tennis, but just only play one day, first day, and overuse it, and always keep extensor tendon tight, right? And then overuse it and cause the pain. Okay, so that's why we call it tennis elbow. But because that's the inflammation of here, and always, not always, commonly from the playing tennis, and then cause tennis elbow. Okay, treatment. After that, you know that's maybe part of that. That's a tennis elbow. How to treat it? Take the painkiller? Maybe, but protection it. Is that right? Right. Okay. If you think it right, please raise your hand. Okay, 1, 2, 3. Oh, okay. If that's wrong, please raise your hand. No one dare to say this is wrong, right? Because the most of them, most of the patient wear that, right? Is it helpful? If that's helpful, please tell me why. So everyone, you learn the textbook, you have to base on anatomy, and you know the anatomy based on that theory, and then you will know how to treat it, right? That's because overuse. If you will wear it, still overuse, right? Why? Tennis elbow? Okay, use this, okay? Protection. Totally not use it. Okay, is that right? Is that play in the Olympic game? Want to win the first, the golden plate, and then you just, tennis elbow, stop the play. Because after 4 years later, you could play again. Is that right? No. It's impossible to wear that, right? Okay. You have to wear this. Wear this. And not the whole brace around elbow, but just only this one. There's a sponge here. And distal to the origin area and tight it. Why? You have to convince me to wear this. And why you have to wear this? So you have to explain to the patient how to explain it. Because this area pain, tendinitis, and you have to take a rest, right? But that's an elbow. You have to do daily work every day. There's no time to take a rest, right? So the tennis elbow will last for a long time. That's because there's no time for the tendon to take a rest. And then you bend it here. Then you create artificial origin. Because the bend here and the muscle contraction, and then contraction stop over here, right? You create an artificial origin. The muscle contraction, the contraction force will stop over here, will not pass through the bandage, right? And then that you make it take a rest. Do you understand? 就是说，你把这个束带束在这里，那肌肉在收缩的时候，经过这里变成一个人工的 origin， 它就力量传导不过来，那是不是强迫它休息？对不对？那一段时间后，你戴看看，戴上去的确就比较不痛。那一段时间后休息够了，是不是就长好了就好了？对不对 ？Okay, so you have to wear it, not the previous one. That is okay. That's quite different. Okay, and then you wear this. If that still hurt, some point hurt, you could do the steroid injection or PRP injection. PRP injection originally not for joint, for the knee joint. Originally, this is for the soft tissue inflammation, soft tissue repair, because the PRP there's a growth factor inside, and then inject into the local area, and then growth factor induce the soft tissue formation. Okay, so you could inject PRP or steroid combined with the bandage. Maybe you will cure. Okay, and then combine some NSAID to for painkiller. And then downstairs, down to the wrist, patient comes to see you. The same, wrist pain. What's your diagnosis? Wrist, a lot of a bone, right? Tiny bone inside that. And then just only tell you hurt. Okay, hurt along the radial side. I just said radial side. Patient will not tell you how to diagnose it, right? You have to diagnose. How to diagnose it? Okay, I summarize all. Here, red dot here. That's around the wrist. Here's listotypical. Some bony prominence, listotypical, just the middle of the radius width. Okay, that's listotypical, just parallel to the listotypical and along the radial side of it, or pain over here, or pain over here. What kind of problem? Patient will not tell you. You just have the palpation, observation, right? And then I summarize. Most of the patients come to visit you. These three kind of area frequently happened. Just only say that tendon is over 3 points of that. Okay? One side, 1 point indicate one disease. Okay? Alright, first one. The same anatomy, right? Here, that's a radial styloid. That's ulnar styloid. Okay, that's quite easy to know. But the lower side, this is an ulnar styloid. This is a beautiful. And then more distally 1 centimeter and more centrally centimeter. That's a hammer hook area. So this angle tenderness may be some hammer hook deformity or some problem. Okay, all you know that. And then if you make a fist with the malfraction and then the appearance of a thumb and medical finger. Here, this one. This is palmaris longus. Okay. What's the major soft tissue inside that? Beneath it. What's the company of this one? The some nerve beneath it. That's a median nerve. Okay? So, you know the anatomy. And then, first, dorsal side. Here, tenderness. What kind of problem? The same. You have to know the anatomy, right? What soft tissue pass through this area? What kind of tissue? You have to know your wrist, dorsal side wrist. There's how many compartments? 6. Yes, 6 compartments. This is the first compartment. Okay. And what soft tissue name? What soft tissue pass through the first compartment? Okay. Okay. Soft tissue. So the wrist around all the soft tissue, not just only around the soft tissue, around the wrist, even the ankle or elbow, the same. The wrist soft tissue, that's a spring. Some twisting it, cause the soft tissue strain. Then the cause tendinopathitis, right? Cause inflammation change, or just only tendinitis. And then we're teaching about the decrevance disease and wrist ganglion change. That's a frequently to see in our outpatient clinic. Generally speaking, tendinopathitis, most common that's from this ECRL, ECRB, and the management always rise, the same. So that's a principle, rise, rest, ice packing, run, elevation, compression. Some patients, some protocols say that 10 minutes is okay, but some say that 20, not above 30 minutes, right? And then 4 times per day for 3 days. Why for 3 days? Yes, that's acute stage. Hematoma stage, 1 day, right? And then after that, inflammation stage, maybe within one week. But that's a hematoma, so inflammation stage that happened within 3 days. So these 3 days, you have the right ice packing. First, there's soothe the pain, and second is stop inflammation. And also use the NSAID or take a rest. Range of motion, maybe will not hurry about that. Is take a rest and immobilize it, okay, and prevent to induce more inflammation change. Almost the same, tendinopathy, almost the same. And I want to say that if you make a fist like this and thumb in palm and do the ulnar deviation, if they hurt, then what kind of disease? If they hurt, still hurt. Some patient just come visit you, you tell him to make a wrist like this, just on this position, it causes severe pain. Cannot do the thumb up, cannot do anything, twisting, cannot do the open the can. It's quite difficult to do that because of a pain. There's some loss of strength to do that kind of job. Okay. Speaking about a thumb. The thumb. The whole hand function. Thumb occupy the percentage of the function thumb. You occupy the 30%, 20%, 50%, 40%. thumb， 大拇指占手掌功能、手指头功能的几%？哎，得背啊，一几年20%的举手，30、40、50，占50%，好，占50%。So you get the cause tenderness just like that and hurt over here. This means decrevent. In Chinese, that's a mama shaw. Okay? Decrevent disease. That decrevent, that's an AP or EPB. That's quite important. Maybe there's a happened in examination. Okay? The same. Rise and set, the same. Almost the principle is the same. Okay? And then how to treat it? Holding the baby, working so hard. You're washing the baby, feeding the baby, and wash the can, wash the clothes, do a lot of job of the thumb, and then cause the inflammation change around the wrist. And that means mama sore, because they're quite frequently happening mother. Okay? Here, that's a first compartment, the ten sheaths. Okay? First compartment, the sheaths and tendon, AP or EPV. Press in under it, and then because of the use and cause swelling of the tendon, and then cause inflammation change and induce pain. And then you cannot grasp, cannot twisting, cannot do any kind of job around the wrist, around the thumb. Okay? So that problem. So how to hold in the baby? Is that position right? So everything that's speaking about anatomy. Okay? One is this kind of position, right? The other one is this position. Which position is better? This one? This one is all the weight on the thumb. Okay? Now right. So you have to hold it like this. All the weight just distribute into the fingers. Okay? So you hold in the baby just like this, and then decrease the stress produced on the thumb. Okay? You're holding it. And this is a position, protect yourself. And then you treat it, right? How to treat it? Is that good? Not so good, right? Is that, is the 德国辣椒膏, is that good? Is that right? So that's a common sense, right? Is that right? Use the 德国辣椒膏? Maybe you're right, but the stage, okay? Because there's a pain, that's because of inflammation stage, right? 德国辣椒膏 is that what? 辣椒膏 induce that good circulation, right? But in this kind, just only acute stage, you have what? Ice packing. You want to stop the inflammation, right? So in this time, acute stage, you cannot use this one. You can use the southern pass. Quite different, okay? And then you could use the tapping, because the tapping, that's external, like a external sprinting, shows some force around the tendon. Some force use the tapping to distribute the force, then maybe some effect. And some just do the local injection, steroid injection. I think it's okay, because steroid is anti-inflammation, and second is that soothes the pain, and because there's no inflammation and the pain decrease. But if that injected several times, many times, the tendon, the sheath itself will change. And change to tightness, to tight, and to fibrous change. And use the fibrous change. And the second time injection, third time injection is not so effect. Okay? So maybe every 1 year, just have to inject 2 times. Not above that. If they inject so many times within 1 year, they cause the fibrous change around the tendon sheath or around the retinaculum itself, okay? And some areas. This one, just holding the thumb. And this is some iron plate around this area, and then cause its stiffness. That means your thumb could press IP joint, but totally thumb function will stop by the plate, by the brace itself. Then stop to flexion it, okay? That means stop what? Friction around the wrist. And then stop working about the AP or EPB, right? And then once you stop the function of that, then that means take a rest of the tendon, right? But most mother do not want to wear it. Why? Because that wash the can, wash the clothes, wash the baby, she has no time to wear this, okay? So most of them buy it back to the home, but just abandon it after 1 day or 2 days, because that is not so convenient. And then let's ask for operation. So the operation just quite easy. Just only take 5 minutes. Dissect the retinaculum, and then you open the gate. The tendon no friction on the retinaculum, and then soothe the pain. Okay. So that's a quite easy way, but you have to take care about the nerve. The peroneal nerve, that's a sensory nerve from the radial nerve. The sensory around the first web space area. If you cut it, patient always feel numbness, and always there's no sensation down here. Okay, they will come to visit you again and bother you, and then you have to repair it under the microscope. So you have to worry about this nerve. Okay, and then finish the tendinitis. We go further distal. Here, within that, some soft tissue or bone inside or around it. Who knows? Who knows? Okay, scaphoid fracture. Once you outstretch hand, and then there's a force on the scaphoid area that causes some fracture. And the quite different fracture is that the characteristic of the scaphoid fracture is quite different from the original bone fracture. Most of bone fracture, that's the first one is the deformity, right? The second is severe pain. But it's scaphoid fracture, it's quite different. There's not severe pain, just only a little bit soreness. And some patient just feel a little swelling along the wrist. That's totally no pain. So most of them just feeling about that maybe strain of the wrist. And most of them visit the bone center with the rehabilitation clinic and for the rehabilitation or acupuncture for 1 month, but still feel hurt. And then the doctor just refer to our clinic for X-ray, taking X-ray, and most of them cause the scaphoid fracture. And here, scaphoid fracture, because of stretch it. So around the wrist, the frequency is the first one is scaphoid, the other one is a hamate. Scaphoid fracture, the tendon is over the snot box area. Once you push the snot box area, that causes soreness and tenderness. Where is the snot box? Here. Is sensor pedis longus. Around here, there's some notch. Once you open it, there's some notch around here. There's snot box. Okay? And around here, if there's a push it and then feel tenderness, and maybe you have to take X-ray to find that a scaphoid fracture or not. Once scaphoid fracture, here, if the acute stage, within 2 weeks, there's no deformity or no displacement, then you could do the cast to immobilize it. And right now, that's a casting, just a change to short is okay. Not have to do the long thumb spica. Short one is okay. Okay. And if that already old fracture, above 1 month or displaced, we could do the school physician. Okay, visit. And then we go further again to here. More distal to Starbucks area. What happened? What happened? Yeah, more distal to scaphoid. Almost the same. Well, first is the anatomy. Distal to it. Here. There's a thumb. Carpal, metacarpal joint. Okay. The hurt over here. That means osteoarthritis change. That's because of overuse. Heavy worker. So most of the patients have happened around 50 to 60 because the heavy worker for several 10 more years and then overuse the thumb. Okay, and then they cause the osteoarthritis here. Starbucks is around here, right? Around here, right? And then the equivalent around here, right? So anatomy quite different, but almost the same area within 2 centimeters, right? So you have to differentiate it, okay? After that, you know that you could shave it, use a scope. We use some scope to shave it, debridement, remove some osteophyte, and create a joint like that. And then we see that pinning fixation for 1 month, there's some fibrous cartilage. Fibrous, I do not say hairy cartilage, it's a fibrous cartilage. And because the thumb, that's another weight-bearing area. So once the fiber cartilage formation well, and then there's a pain-free because that's not weight-bearing. Not like your knee joint, right? Your knee joint, that's a mean higher cartilage. But this, if they formed fiber cartilage, I think that's okay. And patient will satisfy this kind of method because you use this we preserve the thumb function. The motion will not change. Okay, so this kind of one kind of method to treat the CMCJ carpal metacarpal joint osteoarthritis. Okay, so this 3 disease you have to differentiate it. Once patient step inside, you just don't say some area radial side pain. It's a kind three kind of state. Then you occupy 90% of patients. Okay. After that, hemifocal fracture, the common occurred in holding the sports implant, such as tennis, any cane like golf, hockey, baseball bat, okay, hockey stick. Once your stick like, then because hitting the ball and then the rebound force around the hook area and cause the stress fracture, cause the fracture just like this. Okay, the tender point always around this total pisiform and then central to pisiform around 1 centimeter to 1 centimeter. Okay, so just on some patients and some basketball player just told you that palm area tenderness. You will palpate it. Maybe around the hook of female area caused the tenderness. That means maybe there's a fracture of the hook of female. Alright, then not the hurt. Then that's a numbness. Okay, around the wrist, around the hand, numbness, severe numbness. What kind of nerve? Injured or compressed? Commonly, that's in hand and palm and fingers, especially thumb, index, and middle finger, cause numbness and have a tingling sensation. And if that got worse, midnight pain, midnight wake up because of severe numbness, and even you are riding a motorcycle for a while and your fingers feel numbness, and you have to shaking it to release the discomfort. Okay? And then, what's your diagnosis? What's your diagnosis? Why you will suspect that's a median nerve? Why you will not suspect that's another ulnar nerve? First, you have to read anatomy, right? What I say always from based on the anatomy. Okay, median nerve, palm area, half of the ring finger to the thumb tip. That's a median nerve distribution area. And middle finger and half the ring finger, that's a ulnar nerve. Okay, radial nerve, dorsal side. Okay, in the thumb base area. So you have remember that anatomy, and then you know the anatomy, then you know. Just patient tell you numbness, then you know what's the nerve distribution, median nerve. Okay, so maybe that's cause some problem around the median nerve. Okay, then you do the examination, the same. Okay, tenial sign over the wrist area, you percussion it, you have some shocking sensation to the fingertip. That means some median nerve compression over here, and then cause the numbness. So you percussion the wrist area, and the nerve injury. First one is the carpal tunnel syndrome. That's a median nerve, and claw hand just like this. That's ulnar nerve. But today I will not teach you about ulnar nerve, and the other one, third one, jump wrist. That's a radial nerve. Just wake up in the morning after drunken, and wake up. Wow, your wrist cannot extend it, but because the ulnar nerve compression and the radial nerve compression, and cause the numbness. But 70 to 80% will recover it by itself within 4 months. Okay. Okay. Carpal tunnel syndrome. That's because the typing, overuse, or just washer, overuse your wrist and cause the nerve compression. What's the carpal tunnel? That's a tunnel, the bony tunnel, and then some soft tissue goes through the tunnel. How many tendons go through this tiny tunnel? Hey, anatomy. The same. How many tendons? 9, 8, 10, 9, 10, 9. Is that right? Is that right? Okay, from this class, from now on, you will remember until you test. Why? Once you are boys, you go to army. In army, you have singing a song. What kind of song? Which song? 九条好汉在一班. Okay? Everybody know how to sing it, right? So that's a 9. 九条好汉在一班. And within that I have a 班花, right? 福利社班花. 那个班花就是 median nerve. So within the tunnel, there's a 9 tendon. First up are profundus and superficialis, and one is the muscle. First up, pollicis longus. Okay, totally 9. And median nerve is in it. So 10 soft tissue crowded in this kind of tunnel, this tiny tunnel. Call if someone information change, maybe conveys about the nerve, right? And it caused carpal tunnel syndrome. Okay, it's easy to understand it. So if that conveys a long time thin muscle atrophy, and then you cannot grasp, now you can battle. Okay, you have to. You just only could do like this. You cannot do the aponeursis. Okay, so that's loss of some function. And then you can percussion it the same, tenial sign, or use just a Farben test. Yes, if that within 1 minute cause numbness of a fingertip, that means maybe that's a carpal tunnel. Okay, because that in this kind of position, that increase the pressure around the tunnel, and then increase the pressure, and then compress the nerve and cause the numbness. And then somebody using nerve conducting velocity (NCV) to test the nerve velocity. And then if there's some decrease it, because that means now some nerve or compressed, cause injury around the nerve and cause decrease the velocity, okay, and the amplitude, and then we will know which area caused the numbness, caused the compression, and then use that to diagnose the carpal tunnel syndrome. And most of them just only reach injection, no. Treatment, no. Or just receive operation, not definitely. If that use the conservative treatment, okay, I think that's just a conservative treatment. But most of them will not function well because everybody will tend to have to work it back up. Okay, always repeat work. If you want to protect it, you have to do just that. Some sprint, just like this. And this iron plate, the same. Restrict your wrist function, then take a rest of your wrist, then will stop the inflammation and maybe some effect. Then rehabilitation, okay, or take some painkiller, just acetaminophen or diclofenac, then soothe the pain and then reduce the inflammation size, okay? If that totally not work, or then do some rehab by yourself, just like this one. If that don't work, receive operation. We just relieve the transverse carpal tunnel, carpal ligament, okay, transverse carpal ligament. That's the original wound, large one, and always cause hurt within 1 month. Right now, we use the tiny hole, just like this, and to release this one, transverse carpal ligament. Once I release it, and the night, sleep very well, because there's no numbness again, okay? Then, claw hand, drop hand, up hand, bishop hand, let's skip it. The other one is a substitution here is the hand and fingers. Previously, that's a wrist, around wrist. Right now, we're around hand, okay? And this one, okay, today, if you could do what I say, right now, just only one, that's enough. Then you one, just only one. Then I will invite you to 如斯葵 tonight. Okay, how to do that? First is that the game is that this finger extension it. That's little, right? That's 4 extension, and I define that totally flex it. That's 90, right? Okay, 90, and little, right? That's 4 extension, 4 flexion, and some just like this, and then extension your middle finger just like fuck you, okay? And just only this one is extension, little, and the rest of the fingers, index, ring finger, and little finger, 90. One could do that. Anyone? Not so easy, right? Why? Yes, that's so good. There's an MP joint, not fresh. Your MP joint have to totally fresh. Yes. Not so possible, right? Why? Okay, in this part I just explain in Chinese. 来，这个图就是跟你讲说，我们手指头要诊断 profundus 或是 superficialis， 你怎么诊断？一根手指头2个人 tendon 啊，对不对？你断哪一条你怎么知道？好，那你如果说要诊断的很简单，你如果我们的 profundus 就是控制这个手指头最末端的 profundus 嘛，对不对？我们 profundus 的功能是一致的、一起的，就是说它一旦有一根在弯，其他都跟着一起这样子弯就对了，它没有办法单独行动。但是 superficialis 可以单独行动，这样懂了吗？懂了哈，好，定义是这样子。那你如果说诊断中指的 superficialis 怎么办 ？profundus 的功能是不是要把它 block 掉，才办法单独检查 superficialis， 对不对？怎么单独 block 掉？很简单呐、你只要把其他手指头都完全伸直，压住。这时候你压住了其他手指头，是不是它的 profundus 被你压住了，就没有功能了嘛？对不对？已经它是同样一起动的嘛，它是联动的。所以这时候如果你中指可以弯曲的话，代表它什么 ？superficialis 是健全的嘛？这样懂了吗？那如果说 superficial 这个没有办法弯，就表示 superficial 断掉了嘛？那你若检查 profundus， 你只要把手指头其他地方限制住，这边还可以动，就表示 profundus 可以动了嘛？这样懂了没有？记住哦，这个检查这个会考哦，好，我已经讲了70分钟了，60分钟了，已经超过70% 了。好，吐台湾语，不用吐English了哈。好，那个 mother finger，mother finger that's some joint of the fingers. Just some play basketball, the joint of your finger. Then your fingertip always kind of extended, okay? Always keep it in the flexion position. And then, just like this. And the mother finger have soft mallet and the bony mallet. If that's only soft tissue, that's okay. Spring it 4, 6, 7 weeks. Never spontaneous healed by itself. But most of the time people will not do that because somebody said, well, I want to wash my hand, I want to take it out and take a shower, and then just replace it, just put it back and keep it extension. There's no possible, no use. So, if there's a bony mallet, you have to do the fixation, bony fixation, okay? And you can spring it just like this. But frequently, patient remove it by itself, by himself. Then totally no use. And then most of them will see the operation. And the other one is a wrist ganglion. That's a joint fluid that comes out because of overuse. The joint fluid secrete so many fluid is within the joint, and then there's no space for them to replicate it. So most of the fluid comes out from the capsule, okay? And then just like this. And most of them, if they feel hurt or discomfort, then remove it with that ganglion cyst. But we have to remove the stalk at the same time. If that's a remove the cap, and then preserve the stalk, then we will secrete it again, and then form the ganglion again as a recurrent, okay? So if you want to cure it, you have to remove stalk. Then trigger finger, the soft tissue. The finger always overused, and then some wake up in the morning, your finger cannot extend it. Locking in a flexion position. That means that your finger is swollen and some nodule formation. And inside the nodule that cannot pass through the A1 pulley, okay? And then incarcerate inside. And then you have to force to raise it. So that's a trigger finger. So if you want to cure it, you could steroid injection, and most of them were recurrent within 5 months. So we just do the A1 pulley release. This is tiny wound. So that's easy, and within one minute, I think that's all cured. So A1 pulley release, that's okay. And the other one is fracture and dislocation. What I want to say is that thumb fracture, base fracture, you need to fix it because that's a oblique one, so easy to displace again. So most of them have to receive the pin fixation, okay? And the other one, the finger, most of fingers joint phalanx fracture, carpal bone fracture, and the principle. I want to say that the principle. You could fix it with plate, with pin, any kind of method you could fix it. But the principle is that it should be parallel, facing the scaffold. Okay? If you do not do that, you will see the scissor joint, cross the finger, then you cannot grasp anything. Okay? Just like this. Wow, that's good. That's not deformity. That's a alignment as well. But just like that. Okay? So you have to fix it again. And then return to the normal function. The same, just on a couple of linear fracture. That's okay. Linear fracture, 大概辐射在这 linear is okay. But not this. Not okay. Okay? So you have to fix it just like this. Then return to the normal function. So just only linear fracture is not quite big difference. No. There's some problem. That's like this. And then after that replantation, and the principle is that put the stump in the back and the wrapping in the gauze, cutting one, and then rinse it with normal saline or clean fluid. That's okay. And then put it back and then immerse into the ice water. That's called preserve because that's可以 preserve 因为软组织很容易乱掉嘛那6小时就要接回。那你如果放在冰袋这样子保存的话，可以保存36小时。所以曾经我的病人，曾经小朋友被洗衣机绞断的，从澎湖坐飞机来这边接完又成功的又回去。所以36小时够了Wrist the same Which one? Injured. Index. This one. Okay? Index injury. And then return to normal function. Okay. So I think today that's a talk for 15 minutes. And take a note, summary note is that how to evaluate the injury and soft tissue and bone examination and the principle of treatment. Why I say always based on the principle. And the first one is the anatomy. Okay? And you know anatomy, you know what caused the disease, and then you will know how to treat it. Okay? 好，安尼讲了啊，吐音就是吐了啊，嘿，有什么问题无？讲台语啊。有什么问题？有什么不懂的？真的有什么真的听不太清楚，需要中文再更加解说的，有没有？考试只有3题而已啦，全部都在里面真的都在，没有的话你打电话给我，我就送分，好不好？好，不会太难那我想，如果说真的有幸让你们跟到门诊的时候，那大概70%，一节门诊就可以大概6、7成这些病都已经提过的，绝对不会跳脱这些，好不好？那跳脱的大部分都是外面转过来，已经需要我来收拾的这种东西就不太一样了大部分都是这些那甚至跟开刀房的时候都可以要那个 CTS 卡巴丹的心脏 release， 那大概都可以看到3、4个那 trigger finger 大概一个门诊都会10几个所以都很简单，都可以看得到好不好？那希望你们这个学习快，那假日中秋节快乐，好不好？好，谢谢各位，谢谢。